Hi everyone, welcome back. This is Lori Geiselman. We are continuing on with the Behavioral Health Certificate Program. We are in Module 4. Tonight I am going to cover crisis intervention. I'm going to do my very best to stay within about a 15-minute timeline, and we'll see how I can do with that. Since you have watched two others, you know that I went over a little bit, so I'm going to do my best to keep it a little less lengthy. Crisis intervention. As you can see from the various pictures here, there are different types of crisis and different ways that people present when they are in crisis. We've got the young lady who's very tearful, and we've got the woman on the phone who's very obviously angry, and then we have the fellow below on the right that appears to be in some sort of having a meltdown that is dangerous, and he's being aggressive, and he has a weapon. And so these are all very different and will call for different responses. But of course, every time someone's in crisis and they come in, and especially when we don't know people, we need to be mindful that we should be prepared for different case scenarios. We are going to be required to understand some of this in order to create a safe environment for our patients, for ourselves, for our coworkers. We want to provide good care with confidence, with consistency, and be professional. We want folks to come in and know that they can be safe in our offices or our buildings or wherever they're coming. And that requires us to recognize and safely respond when people are disruptive and, yes, sometimes even violent. What does that mean? What do we do? Okay, and if behavior does escalate to violence, then we would need to have the skills necessary to ensure the safety of everyone. And sometimes it will just mean that we know the protocols, that we know who we should contact if someone is to the point where we're worried about violence. So we want to encourage and promote courteous interactions. This means embracing value and diversity of our clients. Now, Module 5, we're going to be talking a lot about embracing and valuing the diversity of clients, of our patients, of each other in the workplace. These things are super important. We're not going to cover too much about it right now because we're going to dedicate much more time to that later on. Respecting everyone's privacy will encourage and promote courteous interactions. People will not feel respected if we are not looking after their private information and or respecting that they have a right to dignity, and that, for instance, yelling out their information and or talking too loud to people about someone's care when you've got someone in the next bay, or chit-chatting about the patient that you just saw a few minutes ago and that person has no need to know. Expecting the best from ourselves will also promote courteous interactions. We need to be professional, and we should accept nothing less from ourselves. And also expect the best from your patients, your clients. We find what we're looking for in people. And handle grievances thoroughly and promptly. As soon as we know there's a problem, we want to do something about it, and not to pass the buck or assume, oh my gosh, well, so our patient is walking up the hall to see Mary, so I'll let Mary take care of it. If we are the one with the information, then we should, if we have the power and control, to get in there and do what we can. Before and during crises, we want to pay attention to behavioral warning signs. So even before a crisis occurs, we can often look around and see that perhaps someone is becoming upset. We don't need to know too much. We know what that looks like. People up pacing, or uh, people talking louder, and that sort of thing. Consider objects that could be used as weapons. We want to remove those things. So for instance, if someone is coming up to a desk to talk to someone and they're upset, perhaps we want to remove the stapler that's hanging out towards the end where it can easily get picked up and thrown. Practice and promote a team approach. Remember that the client, the patient, they are a member of the team as well, and you want to share that with them, that we respect that they're the lead member of their own team and we value their opinion. But also remember there are other people that can help. We don't have to handle everything alone, and sometimes either tag teaming or having someone else come in to give it a try if it's not going well with us would work. Assess your work environment and trust your instincts. For me, those go together. We sort of have these instinctual things occurring while we're assessing our work environment. So when we come in, we take a scan, we look around at what's going on. Assessing your work environment could also mean take a look around and assess whether you have any safety concerns, or if you have policies or procedures that need to change, and having these conversations outside of the immediate time when a crisis occurs. Sometimes it might be a feedback loop. We had something happen in the office, and now tomorrow we're talking about it and assessing that environment. So we want to improve our processes wherever we can to increase safety, and educate yourself about relevant response protocols. Who do we call? Do we have a security person, or do we call 911? What are the rules in our agency? Do we have a person right here? Or not, that kind of thing. And or if I have an angry client, am I supposed to call my supervisor, and or am I supposed to try to handle it? So those kind of questions you want to be asking. When a person is in control, these are the things that we will see. Their appearance, they'll appear calm, they'll appear centered, self-assured. Even though they may not feel it, we won't be able to tell that from the outside looking in. Relax your facial muscles. Look confident. Don't show anxiety. Even if you're feeling anxious about what's going on, you want to appear confident and in charge, if you will, but not I am going to tackle you in charge, but I've got this. I'm going to be able to help you. I can manage this situation. And that not that you're about to run and hide. Use a modulated, low, monotonous tone of voice, because our normal tendency is to have a high-pitched or a tight voice when we're scared. Think about somebody when they see a mouse, or a bug, male or female, it doesn't matter. I've seen some high screaming guys with bugs. And so it's not, a male-female thing. Remove, if you have time, remove your necktie, scarf, hanging jewelry, religious symbols. Sometimes things like that would even set people off or offend people. So we want to be mindful of what we're wearing to work. The jewelry, the scarves, the ties, that's really thinking about, am I giving someone the opportunity to harm me with something that I'm wearing? Or earrings, loop earrings, people can grab a hold of them and rip them out of your ears, and that is something to think about, that you might not want to have that stuff on. Most work sites will have policies around jewelry and neckties and how you wear your badges. Some places don't like the lanyards because you can get choked with them. Other places it's okay. Where I work at a couple different places, one is okay with the lanyard, and the other one likes your badge clipped on your shirt up here and nice and tight, and you can't use it as a weapon. So again, it really depends. More on control. Don't be defensive, even if the comments and insults are being directed at you. Also, don't go and rescue the person who's being insulted. What you really want to do is try to figure out what's going on if you're watching this situation, and get help. And if it's you, you stay calm. You don't respond to the insults and comments. You just answer their questions matter of fact and truthfully. Be aware of any resources available. So, am I supposed to call 911? Do I have a supervisor on call? Is there a panic button? Do we have security? What is the security number? So, knowing all of that in advance will help you to be that calm person I talked about in the slide earlier. When we said appearance, you want to appear calm. Be very respectful, even when you're setting limits or calling for help. And you want to understand that if you are calling for help, the person can hear you. They know what you're doing. And so how you frame that call, you would not want to say, come and get so-and-so, they're out of control, they need to go. It's going to sound a lot better if you're saying, I could use a hand. I'm trying to help one of our patients, and I'm not able to help them right now. So was thinking you might have some better ideas. I'm on such and such a floor, and oh, thank you so much for coming. It also signals to the patient that, hey, someone's coming, and that might give them a minute to collect themselves too. And you can also give them that out, which we'll talk about when we say more about de-escalation. The physical stance, don't turn your back for any reason. Always be at the same eye level. If the person is standing, you stay standing. If they sit, you sit. You don't want to tower over them if they do decide to sit. You invite them to sit, invite them to take a less aggressive stance if you can get them to. If they don't, then create extra space. That's the next one. The angrier they are, the more space you want between you and that person. Don't stand full in front of the person. You want to stand at an angle. This gives you more stability. If someone should give you a shove, for instance, you're less likely to fall if you're standing at an angle. You can also step away easier, sidestep, if you will, if they're going to try to throw a punch or slap you or something, you can sidestep. Do not maintain constant eye contact. Allow the person to break their gaze. You don't want them to feel as though we're attempting to have a staring contest. That is often thought of as aggressive and not a good idea. Don't point or shake your finger. That can also be viewed as aggressive and starting something. Do not smile. This could look like mockery or anxiety. Some of us are nervous smilers or jokers. You want to be careful with the jokes too, because do not point your finger or shake your finger. There was a fellow I saw saying to one fellow or another fellow, don't point or shake your finger at me. And the guy came back and thought he was being funny, and he gave him an elbow, and he said, oh, how about if I point my elbow? And next thing you know, they're both on the ground. So that was not a good response, and the person did not appreciate his humor. So you want to be careful with humor. You want to make sure that that person is someone you can do that with. If you don't know them well, save that for later as you develop your relationship and build trust. Don't touch them. Even if it's culturally appropriate, it may be interpreted as hostile or threatening. You know, if you feel like it's appropriate to help, perhaps they're trying to get their coat off, and they're struggling with it, or they're trying to put one on, and you could say, could I help you with your coat? If they don't say yes, then don't help them. Keep hands out of your pockets. You need them for defense possibly. So if they're in your pocket, it's going to do you no good all of a sudden if you need to block something coming your way. Do not argue or try to convince. When people are really angry, they're not in a mindset where they're able to have a rational conversation where you're convincing them of anything. Don't be defensive or judgmental. Oftentimes it is not about you. This is something about the person. They're in crisis over something, they need help. And judging them is also not helpful because we don't know the whole story. Oftentimes when we step into a crisis, there may have been 10 other things that happened to that person before we've engaged with them that we know nothing about. So save the judgment until we know the full story, and that will serve you better than trying to, tell them exactly what you think of them or otherwise uh, provide your opinion. Making the best out of a bad situation is an expression that we like to use. Oftentimes we do a better job of that when we plan for unexpected, the fire drills, the tornadoes, the hurricanes, the bad snowstorms. When we plan for those things that, well, maybe not likely that they're going to happen, but they could, we're going to respond in a much calmer and efficient way. And crisis is no different. People who practice dealing with crisis all the time, and or at least think about it and go through a fire drill in their head around what they would do, when they actually have to process it in real time, and it's usually like this real quick, you're going to see how much it helped that you actually thought about what you might do in a situation. We want to explain limits and rules and be firm with a person, but always be respectful. And with the authoritativeness, again, it's just keeping in mind that everyone's safety is your agency's responsibility. I'm here to make sure you get the help you need. I want to make sure you don't get hurt or that other patients get hurt. I want to make sure you get seen today. If you're arguing and all that, it's going to make it difficult for us to see you. That is where telling them about consequences come in later on, in terms of, what does that mean that you're going to tell someone about the consequences? We're going to call the police, you're going to get arrested. That's not really what I mean. Could that happen? I suppose it could happen, but how is it going to help to de-escalate if you say that? I want you to think about that. Emphasize with feelings, but not with the behavior. I'm sorry, empathize, not emphasize. You want to empathize how they might feel. Understanding that they feel angry about something. Sometimes people like to hear that you appreciate how this must be for them. And they also want to hear that I'm prepared to help. Tell me what I can do. Oftentimes, if you give them a minute to stop to think about what it is they want you to do, their anger will let down for a second, because it's a weird thing. Like, your brain can't be really, really angry and have rational thoughts at the same time. So we want them to switch to the rational thought. Don't solicit how they're feeling or try to interpret or be their therapist. Don't argue or convince. We already said that. Wherever possible, you want to tap into the thinking mode. That's what I was saying on the last slide. Help me to understand what you're saying. Help me to understand what you need. I really want to help. It's tough for me right now to help you. I'm not quite sure what you're asking me for. Remember, there's no content except trying to calmly bring the level of anger down to a safer place. This isn't a time for a lecture. This isn't time for vast opinions. Oh, when I was in your shoes once, I did, we don't have time for that right now, and we just need to calm things down. Think comfort sometimes. A glass of water. Here, can I give you a drink? You seem dry. You'd be surprised. They take a minute and they take the drink, and again, it's that whole I can't do two things at once. People really can, but it takes a lot of energy to be so angry. Don't get loud or try to yell over a person who's screaming. Wait until they take a breath and then try to, sneak a word in there. But talk calmly. Respond selectively. So if they're asking you a question, for instance, about their treatment, then answer that. Or if they say, Well, how the heck much longer is it going to be? Give them an estimate. It should only be about 10 to 15 more minutes. But give them an honest answer. If you know for a fact that it's going to be another hour, then don't say, "Oh, geez, you're gonna be here a real long time. You better pack a lunch next time." That's not going to work. If they ask you a question that is inflammatory and like an expletive, and they want to know why you're such a B word or something ridiculous, you can read the example on the slide, then you don't want to respond to that. You want to go on to something else. It doesn't mean that you just stand there and stare at them and don't answer them, but you bring the conversation forward and back to de-escalating. We really want to be able to see you. It should only be about 10 more minutes. And just understand, though, that once you're calm, we'll be able to get you in the next room. When you're ready, when you're feeling able to go into the exam room, let me know. I can't take you while you're really mad. Usually they'll be like, yeah, I'm ready. I want to go now. Okay, deep breath, drink this for me. Or okay, give me 5 minutes. I'm going to go get the room ready right now. So wait right here. Go get the room ready. Come back and see how they are. That kind of thing. Suggest alternative behaviors where appropriate. Would you like to take a break? Would you like to have a cup of water? I just mentioned water a minute or two ago. Give the consequences without threats or anger. Again, it goes back to, I'm calling the police on you. That's not the best thing to say. Give the consequences. We really want to be able to see you. Unfortunately, while you're in this state of mind and so upset, the doctor's not even going to be able to have a conversation with you or see you. We need you calm enough to be able to have a conversation. Present or represent external controls as institutional rather than personal. So we don't like throw people under the bus and name names and that sort of thing. We just talk about the best practices, or why, a test might take 45 minutes rather than say, yeah, we're lined up around the block because so-and-so overbooks MRIs, whatever's going on. You want to keep it generic and again, not try to pass the buck onto other people and or give them another reason to escalate. Trust your instincts. If you feel that de-escalation is not working, and this slide suggests that you'll know within 2 or 3 minutes. I don't know, I've never timed it. That sounds reasonable. You're gonna seek help and follow whatever your agency's crisis response plan is. And then there's nothing magic about calming a very angry or agitated person. You want to make sure that you're sending them the message that you care about what they need, you're interested in what their issue is, that you want to transfer that calmness, and also let them know that you're genuinely wishing or that you understand that they really want to respond positively. That is going back to what I said earlier, expecting the best in clients. They're just so upset right now. They're distressed about something. They want something to be better. And we want to help them to get that if we can. With everyone being safe, of course. And I can't wait to talk more about this when we get together, or you get together with one of my colleagues. The conversations are always great from experience. And if you have ideas and questions, please make sure you bring those to class with you, whether it's Zoom class or in-person class. Appreciate your listening and looking forward to seeing you, or one of my colleagues will see you. And if there is a quiz, which I do believe there will be a short one, please don't forget to take that. And this says it all. You're awesome. I appreciate your participation. Bye.